back to the Ageless Pet Podcast, where we break down the science behind your pet's health in a way that actually makes sense. I'm Dr. Carmen Bausona here with Dr. Varco, and today we're going to talk about vitamin D in our dogs, right? So I think this is a really important one as well. We just recorded another one on fish oil, omega-3s, and I think this is another important one too. So everyone calls it the sunshine vitamin, right? That's because for us, we can make enough of it, or we should be able to make enough of it. That's the question though, right? Through sunshine on our skin and conversion of vitamin D from sunlight. But our pets don't do that.
They don't.
They do some of it, but not clinically relevant,
right?
So they can make it, but it doesn't mean anything. They get all of their, or essentially all of their vitamin D through fish. Through food, through fish.
Fish could be one of them.
Fish is one of them.
So,
cod, liver, fish, fatty fish, egg yolk, beef liver. So that's one of the, that's a lot of foods they get it from. So so if you're feeding, lots of organ meats and eggs and stuff, that's really, really beneficial.
Yeah.
But yeah, so that's what we're talking about today. But remember, unlike us, they do not synthesize it in their skin. And everyone knows vitamin D and its relationship with calcium. I mean, that's kind of a long term. We've all learned about that. And vitamin D is really known for its bone health, and it regulates calcium and phosphorus, and that's really important too, especially in bone health, but just in general with like kidney disease, etc. Vitamin D regulation of calcium and phosphorus is really important for your strong bones and your strong teeth, and we've known that for forever. Nearly a century ago, researchers showed that dogs lacking vitamin D develop rickets or severe skeletal issues. But it's more than that, right?
Yeah, it's a fat-soluble prohormone. So A, D, E, and K are your fat-soluble vitamins. So it's really important to monitor the amounts that you get with those, because it stays in the body versus like B vitamins that are...
Or C vitamins,
Yeah, exactly. So it's a fat-soluble prohormone involved in calcium and phosphorus balance, like you said, bone growth and maintenance, cell differentiation and repair, and immune regulation. So we know that research suggests that vitamin D plays a role in immune balance and inflammation. So cellular studies in dogs showed that vitamin D metabolites can increase anti-inflammatory signals like interleukin 10 and reduce pro-inflammatory cytokines like tumor necrosis factor alpha. So translation, because that was a lot of biochem, vitamin D may help the immune system stay balanced, not overreactive and not underactive. And there's been some good human studies with the immune system and vitamin D.
Yeah, and I think that's when, I think I'm a little late to the game on the vitamin D supplementation, etc. Is that, I mean, I knew it was important, etc., for your bone and whatever, but I think the immune thing is what really got me, and it really started in around 2020 with the COVID stuff, and we'll talk about that research later. But early in COVID, there was some research that came out, and again, we'll talk about it later, that has shown that it was really beneficial for your immune system, and your immune system again, and the inflammatory markers are so much that we always talk about. Inflammation is disease, inflammation is aging, and this is one of those things that again doesn't amp up or decrease necessarily. It's more like an adaptogenic property where it does balance out your immune system. So I'm huge and big on these vitamin Ds. But how does it work? Simple. I'm not going to go into any biochemistry.
Okay, keep it simple. Let's do it.
So
you are, but go
anyway,
for it.
So absorption. Vitamin D is absorbed from food in your intestines.
Great.
So dogs, again, like we said, that's kind of important. No skin issues. I mean, don't absorb it through sunlight. Transport, it travels through their bloodstream, attached to special carrier proteins and activation. So the liver is important in vitamin D. So you can feed all of it, but the liver converts vitamin D into a storage form called 25-hydroxyvitamin D or 25-OHD. And then the kidney converts this into the active hormone form, which the body actually uses. So, You can eat as much as you want of it, but you do need to have a functioning liver and a
Right.
functioning kidney. So the liver is going to convert it, and then into a storage form, and then the kidneys convert it into an active form.
Yeah.
So those are important because with certain diseases of liver and kidney disease, and sometimes we're not doing that conversion. So
Right.
that's a hard thing. And then regulation. This process is tightly controlled by hormones to maintain calcium balance and protect and prevent against toxicity. So
Which is really important too.
the toxicity, or
Yeah.
I mean, that's one of the things that I never start. And we'll again talk about this later, but I never start vitamin D3 supplementation until I test,
Same.
because it's so important. So
Yeah.
and so the liver produced form of the 25-OHG is key, because that's what we use, and it's what we measure to assess vitamin D status.
Yeah, so testing, it can be a little tricky. So we evaluate vitamin D with serum, 25-hydroxyvitamin D, and that tends to be a standard test for vitamin D in dogs. But there's something important that is often overlooked, and that is that inflammation can affect vitamin D measurements. So we know that in humans, systemic inflammation can lower the 25-OHD levels, and these pro-inflammatory cytokines can interfere with the enzymes that activate and regulate vitamin D in the body. So, in other words, inflammation changes how the vitamin D is processed, not just how much is consumed. And we've seen this in cross-sectional studies, longitudinal studies, mechanistic laboratory research. Basically, a lot of different types of studies have all shown the same thing. And we have fewer studies in dogs, but we see very similar patterns. So we know that dogs with inflammatory conditions have lower vitamin D levels if they have chronic inflammatory disease, certain cancers, or ongoing immune activation.
Yeah, and I think that's interesting because, clinically, let's just use a case of cancer.
Yeah.
Oftentimes when I'm seeing a cancer patient, I'll go ahead and test their vitamin D, and they're usually really low.
Yeah.
I mean, sometimes it's really shockingly low. Again, on the tests we use, it's usually a range of 100 to 150, and I not uncommonly have dogs below 50 and some even below 20, which is scary, that have cancer. And of course, now the question is that, did that low vitamin D3 allow them to get cancer, or is the inflammation caused by the cancer lowering the vitamin D3?
Yeah, that's a hard one.
It's a hard one, but then at the end of it, not the end of it, but we supplement and then we test.
Yeah.
And then we test again, especially with cancer, we're testing. So oftentimes when once we supplement, we're at a good level, and then we're doing all these other good things, like a good diet, anti-inflammatory things like turmeric or boswellia or whatever else, dogs getting healthier, and then frequently I have to decrease it.
Right.
That's why it's so important to test, because I might have a dog that's at 50, and then I get him to 120, which is awesome. We'll keep him there. And then I test again in 8 weeks later again, because that's the testing we like to do it and monitor, 8 to 10 weeks. But then oftentimes it's too high, and then I have to back down. And it's not that we changed how much we're giving. It's just the dog got healthier.
Right.
And then, as you just said, the inflammation.
Right. Like if we're lowering inflammation in the gut and that's where it's absorbed, that's a huge one, right? If we added probiotics, we changed the diet, we did different things because of the underlying condition that we're treating, then often their absorption improves.
Right, exactly. And that's another point you just brought up, is with the microbiome and the bacteria in the gut. So, and again with cancer, that's been shown in some cancers that's off as well, of course. But I would say on my quote-unquote healthy dogs, gosh, vitamin D3 on dogs who don't have skin problems, don't have GI issues, don't have cancer, I'd probably still say 70% of them are below the 100 marker that I want them to be at.
Yeah.
So that's a lot. And again, supplementing is going to be important, but I'd like to test for sure. I don't like just to go on a general basis of 50 international units per kilogram, which has been tested and recommended, but
you can't.
You can't,
right? Because it stays in the body, and so we have to be so careful about the way we dose and monitor this one.
Right. Yeah. So vitamin D3, the side effects or the problems can be significant, so we do have to watch out for that. So.
Yeah, so a lot of evidence with supplementation, like you mentioned, the 50 international units per kg has raised levels without disrupting calcium or phosphorus balance, which is really important because we know that when that's all off, we can get changes in our soft tissues like mineralization and a lot of different things.
Probably don't want to mineralize our soft tissues.
We probably don't. So
they're not soft anymore.
They're not soft.
Mineralized.
So vitamin D forms vary in potency, right? Like you were saying, one supplement isn't going to be, and there are not a lot of vitamin D supplements out there.
There aren't, no.
There's really a few, and you really want to stick to very tight dosing. So I find, and we use the same one. So liquid is really easy.
It's easier to dose.
It is, yeah. So
unless you have a giant dog, like if you have a really big dog, I mean, you want to give them one of your supplements because they need 2,000 international units, then fine. But
right.
But still, it should be tested for sure.
And when you're adjusting the dose, the liquid is just easier.
So much easier.
So I like that quite a bit.
I mean,
think
most
that's
of my
important.
patients are on like 1 to 5 drops, a day.
Yeah.
So it's really easy to put in there. So, and I think I like the liquid supplements too.
Yeah, so I think that's a really good one to do. And of course, like you were talking about, safety is so important because too much can be dangerous. We know that too much vitamin D, we talked about the soft tissue, but it can elevate calcium, it can damage the kidneys, it can lead to serious injury and illness and even death in some cases. So there's been some good safety studies done on vitamin D, which I think is really important. So it's super important that supplementation is never done without veterinary oversight and monitoring, because it can be risky and you have to monitor blood levels. That's just essential, especially with long-term use. But enough about the scary stuff. Like, let's get back to the good stuff, like why vitamin D has been shown to be so effective.
Because it's not really that scary. It just has to be done intelligently.
I know.
So,
yeah.
But yeah, there are some studies that show that vitamin D levels are common in disease, and low 25 OH or hydroxy D levels have been associated with chronic kidney disease, heart disease, certain cancers, inflammatory bowel disease, and infectious and chronic inflammation. So even when our skin dogs come in, we're testing vitamin D3 levels, omega-3s and vitamin D3 levels. And a study of skin health found that vitamin D3 supplementation may help atopic dogs, dogs with skin disease. One review discussed how vitamin D3 deficiency is associated with increased skin infections, and that vitamin D3 could help regulate immunity and skin. The mechanism of this is that the active form of vitamin D binds the receptors and the blah, blah, blah. Who cares the mechanism, right?
Right.
But at the end of the day, it's good for your skin.
It's great.
So, and as I was talking about earlier, the thing that really got my attention was during COVID. And I remember listening to a podcast where they were talking about how important vitamin D was. This was in the early stages, too, of COVID, the very early stages. And so vitamin D3, I think you may be aware of, you probably heard about it with the COVID, but if not, in humans, ICU patients with COVID, weekly high doses of vitamin D3, followed by a maintenance dose, increased natural killer and other cell counts after a week. And these cells are important for fighting off many such things as cancer and infections. I'm not really going to go into COVID too much because that's not my area of expertise. I'm a veterinarian, not a human doctor. But it goes on to say basically that it decreased mortality in these patients who were getting IV vitamin D3. And
that's so simple.
So simple, right?
Right.
So
and after a week.
Right.
Like what kind of, I mean, that's I think that's a really important study.
It really is an important study, and there was many of them that happened during that time. Unfortunately, you didn't find out about a lot of them unless you were kind of on the deep end. But yeah, vitamin D3, like how simple is it to administer IV vitamin D, and hopefully you get out of the ICU and don't get on a ventilator, because once you get on that ventilator, oof.
That's it.
Yeah, it's a toughie.
I know, but I think it's such an important addition, right? We talked about omegas, and that was like the panacea, the great, right, the GOAT.
Yeah.
So, but vitamin D's up there.
Yeah.
Vitamin D's up there. So
Those
test.
are two of my favorites. I think
Test.
vitamin D.
Well, probiotics too. Are we just gonna go through like all our favorites now? That's just like. But
Probiotics, prebiotics. Yeah, we can't do all that. We gotta do another. I think we've done the probiotics, right?
We did the microbiome one. We talked a lot about probiotics and the importance, but we'll have a whole one specifically on the gut and gut health and all of that. So that'll be really fun. But vitamin D does help so many things, and like you were saying, so many of our cancer patients, we test, we monitor, we titrate up or down.
Yeah, and our holistic wellness panels that we do all have omega-3 and vitamin D3 testing on it because it's so important, to make sure that they're at active levels or levels that we want them to be at. So it's really, really important to do that. And, I usually use a company called RX Vitamins, and they have vitamin D3 and they have vitamin D3 Forte. The difference is the D3 is 100 milligrams per international units per drop, whereas the Forte is 500. So if you have a small dog or below 20 pounds, maybe the regular vitamin D is better than the D3 because it can get to be up there a little bit.
Yeah, I think we all use that company for the vitamin D because it's just like we were saying before, it's so much easier to dose and monitor and adjust in such an intricate way.
Right. And like I said, vitamin D3, like Dr. Varco was saying, such a interesting thing. Once the inflammation goes down, the vitamin D3 levels will start going up.
Right.
So one of the things I would caution about is to get to a level when your dog isn't doing well and then think, okay, now he's doing fine, and then you just keep it at that level because that's not good.
Right.
We got to make sure that we're retesting and doing okay with that too. And then also making sure that our animal doesn't have kidney disease or any other problems or liver disease that might affect the ability to produce, an active form of vitamin D. So, but vitamin D3 supplementation, again, biggie.
That's a big one. I definitely think if your pet isn't on it, just have that conversation. And not a lot of veterinarians really do a lot of vitamin D. There's not a lot of literature, so the dosing can be really tricky. The lab tests, right? Like if you send it to Michigan State University, you've got to convert the units. And so that can be tricky for some people. Other labs will do it for you, like VDI, and they'll give you some dosing recommendations, but your vet should always kind of double check that dosing based on the patient in front of them. But they give really great guidance.
I would bet that sooner or later we're going to start testing normal veterinarians, not as abnormal veterinarians.
Right.
We'll start checking for vitamin D3 as well as the omega-3 status to get optimal health. But you're right. Right now, most of us don't test. So.
Yeah. But they do it in humans, just not as much either. But I have had, healthcare providers be like, "Oh, let's just check your vitamin D." So I do feel like more and more people are going to be testing for it, and that's another important one that I think in humans they test it more just to know if you're high or low. They don't monitor the dose and as much as we do. I just think like we tend to be a little bit more meticulous with it because we're dealing with so many different sizes you got Chihuahua to Great Dane. We're dealing with a lot of different sizes versus in human medicine, what is it, they dose it to like 150-pound person or something. So
I'm a little over that. You're a little under that.
But we'd probably get the same dose,
exactly.
right? So we titrate things a lot more in vet med. So
and we need to because you have a freaking 5-pound Yorkie versus a 150-pound Dane. It's
oh my gosh,
a little different.
Yeah,
it's kind of funny when you think about that.
Yeah, but I think this is such an important supplement, and every pet's unique. Every nutritional supplement should always be tailored to their individual needs.
Yeah, and then do you want to hit the practical takeaways before we go?
Let's do some practical takeaways.
Okay, I'll do one and then you do the next.
Got it.
Boom, boom, boom. Practical takeaways. Dogs do not get it from the sunlight. They get it from their food.
High quality commercial diets usually meet basic needs, but you may need to supplement.
Some dogs, especially athletic dogs with chronic illness, malabsorption issues, so GI issues or other inflammatory diseases, they still may not be sufficient.
Right, and that's a big one.
Right.
And then serum 25 OHD testing is the best way to assess status.
Inflammation can influence vitamin D level status, so results should always be interpreted in context of that pet at that time, snapshot in time.
Yeah, and then supplementation should be targeted, monitored, and individualized. So if you have 2 different pets and they're both on it, they're not necessarily going to get the same thing, even if they weigh the same.
Yeah, and I might actually get some of the patients that have more chronic diseases or illnesses, I want them on the higher end of that normal spectrum than the lower end. I mean, if I have a dog who's normal and they're around 100, I'm okay. But if I'm really worried about that pet, I might want to push him towards 150.
Yeah,
So,
and looking for trends, I think, is important too.
yeah, so, yeah, as you said, targeted and individualized vitamin D is essential, but more is not better.
That's right.
Exactly, it's not always the same. So, anyways, that's our kind of whirlwind tour of vitamin D3.
Yeah, I mean, it's simple.
Simple.
It's simple.
Very easy.
Mm-hmm.
Yeah, not as easy as omega-3s, but pretty damn easy.
Pretty darn easy. Pretty damn easy.
All right, guys. Thank you again. Thanks for joining us.
All
Bye-bye.
right. Take care. Bye-bye.